This is In the Loop. I'm Christian Bryant. I would do this whole show in a mask, but I want to make sure you can hear all of my corniness. Here's what you need to know right now. The nightmare is over for dreamers, for now. Today, the Supreme Court ruled that President Trump cannot end DACA or the Deferred Action for Childhood Arrivals program. The close 5-4 ruling said the government failed to give adequate justification for ending the federal program, which prevents deportation for undocumented immigrants brought to the U.S. as children. There are more than 600,000 people protected under DACA in the U.S. today. It's a hot spot for summer vacations and now rising cases of the coronavirus. But Florida isn't slowing down its reopening.
We're not shutting down. We're going to go forward. We're going to continue to protect the most vulnerable.
New data shows one county in the middle of Florida saw 264 new cases in 1 week. Health officials studying the clusters say it's likely tied to the reopening of bars near the University of Central Florida. 6 separate hangings, all of them ruled suicides. But the similarities have sparked a national conversation over concerns these could be lynchings.
Both families have stated both men were looking forward to enjoying their life, and both hangings make no sense whatsoever.
The cases are spread across the country: Oregon, Southern California, Texas, and New York. And all of them involve people who are Black or Hispanic. The FBI and Justice Department are further investigating the 2 cases out of California. Saying he's the director of the National Institute of Allergy and Infectious Diseases is kind of a mouthful, especially because at this point, most Americans simply know Dr. Anthony Fauci as the nation's top doctor on coronavirus. I guess once Brad Pitt plays you on SNL, you've reached a fairly high profile. But way before COVID-19, Dr. Fauci led the US public health response to another wide-reaching virus. For Newsy's virology series, Cody LaGros spoke to the doctor about what the past can tell us about the present pandemic.
Yes, ladies, it's June, formerly known as Pride Month. And with LGBTQ plus rights at the forefront, in the middle of social unrest and a global pandemic, one very important doctor decided to make a house call.
Hello.
Hello, Dr. Fauci. How are you today?
I'm well, thank you. How are you?
And we got right into it.
I read something that you said HIV is really simple compared to what's going on with COVID-19. What do you mean by that? Can we touch on the stigma real quick? Will the gays ever be able to brunch again?
Yes. Yes, and I'd be happy to join you.
Okay.
You could call Dr. Fauci an ally. In the 80s, he fought for wider access to HIV treatments that saved countless lives. In the 2000s, he was part of PEPFAR, a program to reduce transmission of HIV/AIDS in poorer countries. And that epidemic has something in common with COVID-19 today, a deeper impact on poorer communities of color. Look at the HIV/AIDS epidemic, a thing that is still very much happening in the United States. In 2018, Black people accounted for 13% of the population and 42% of new HIV diagnoses in the U.S. COVID-19 is no different. In places like Chicago, Black people are 30% of the population, but 60% of its COVID deaths. Pandemics expose yet another way we fail people of color.
Because of the social determinants of health and the positions they find themselves in economically and regarding employment, they, in fact, have a higher risk of getting infected. And when they do get infected, they have a disproportionate amount of the comorbidities that lead to a serious and often fatal outcome: heart disease, hypertension, diabetes, obesity. So the disparities are very, very similar.
Our healthcare system parallels our social justice system. It's dismissive of Black people.
Deja Abdul-Haq is the director of My Brother's Keeper and Open Arms Healthcare Center in Jackson, Mississippi, a clinic that caters to Mississippi's LGBTQ+ community in a state with the highest concentration of Black people. Mississippi is in the middle of HIV and COVID-19 epidemics. Treating HIV and COVID-19 share similar complications for people of color, including access to testing, treatment, and education. Still, the clinic never shut its doors to the people it serves, typically low-income and or queer people of color. Mississippi is still seeing a rise in COVID-19 cases. Hospitals are concerned about capacity, and yet it's reopened and back to business.
There are a lot of people who believe that the reason that our federal and legislative leaders wanted to reopen is because they noticed, oh, this is impacting Black people. So it's okay for, Black folks to suffer.
So why do the perceptions of infectious diseases linger for some and not others? Stigmas surrounding HIV still exist, but with COVID-19, they pack less of a punch.
Whenever you have a disease that's new, that tends to selectively or predominantly affect a certain demographic group, that group often gets blamed as the source of the particular illness in question, the particular infection.
I talk about the Chinese virus.
Back in the early years of HIV, it was not good at all. Racial and ethnic groups get stigmatized because of that. The reason I don't think you're seeing that so much with COVID-19 is that this is an infection that spares no one. Right now, we have a situation where we're trying to end HIV in the United States. And in fact, this administration has put together a program to end it in 10 years. Hopefully, we'll be able to do it.
So as places like New York City bury unclaimed bodies from COVID-19 in mass graves at higher rates on Hart Island, a familiar site for unclaimed HIV/AIDS victims, Abdul Haq says we can start saving our brothers and sisters through societal change.
Stop making it okay to mistreat Black people. Stop making it okay to dismiss gay people. Stop making it all right to not consider the needs of poor people. Stop doing that, because eventually the evil that has to be fed is gonna come for the next joker.
When we're back, we're highlighting the greatest or weirdest hits from Twitter's trending topics.
We're gonna go deep.
We drove across the state to get here. We're working hard to get you the news you need.
We dig a little deeper on the stories of the day
That's why we're here.
to help start making sense of it all.
Sure. Memes and cat videos are fun, but actual news might be a bit more useful. Follow Newsy on Facebook, Twitter, and Instagram to get straightforward, opinion-free news right on your social news feed.
We're going inside the dark and twisted mind of the internet, also known as Twitter.
Why are you wearing a tux?
It's after 6. What am I, a farmer?
Since NBC's 30 Rock went off the air in 2013, we've been living every week like it's Shark Week. And now the show is giving fans something to look forward to. A new hour-long special will have all the show's major players, including Tina Fey, Alec Baldwin, and Tracy Morgan. But in a very 2020 twist, it'll also be remotely produced, meaning it'll probably look something like that Parks and Rec reunion we got a couple of months back.
I've been practicing social distancing since I was 4 years old.
Folks, Twitter thinks Beethoven was Black, and it's leading to some absolutely incredible content. Turns out today's Twitter trending topic is just the latest note struck in a century-long saga around this question of the legendary German composer's heritage. For the record, there's no hard evidence that suggests Beethoven was Black or that any of his ancestors were of African descent. But descriptions of Beethoven's curly hair and darker complexion have been stirring up theories about his heritage for more than 100 years. So Beethoven almost definitely wasn't Black, but hey, we still got George Bridgetower, Francis Johnson, and the Chevalier de Saint-Georges. More drama over the new book from former National Security Advisor John Bolton as the Department of Justice tries to block the book's release. In the book, Bolton, who worked for President Trump in 2018 and 2019, alleges the president asked the Chinese government for help in winning the 2020 election. The book's publisher says the effort to stop the book's release is coming way too late, considering hundreds of thousands of copies have already been shipped around the world. Before many of us learned about Rayshard Brooks, he was a carpenter, a father, a husband, and a man who had experience with the criminal justice system. Months before his death, Brooks opened up in an interview with Reconnect, a group working to fight recidivism and incarceration. Newsy's Jamal Andrus tells us more about what we know about Brooks from his own words.
Some of the system could, look at us as individuals. We do have lives, it's just a mistake we made, and, not just do us as if we are animals.
A few months before Rayshard Brooks was shot and killed by police and became a rallying cry for activists across the country, he did an on-camera interview about readjusting to life after serving time in prison.
My oldest daughter, Dad, she's, hey, I love you so much, but where have you been? And I have to, feather up the energy to let her know everything that has went on within me and the situation that I have been through.
At least 95% of all state prisoners will be released and return home. More than 620,000 people are released from prison annually, but there are significant barriers that many say extend the punishment long after release.
What the brother was experiencing and what I experienced, and many of us experience still today, even though I'm not on parole anymore, is this scarlet letter.
Jay Jordan is the executive director of Californians for Safety and Justice. But just 8 years ago, he was in a similar situation to Rayshard Brooks. Jordan went to prison for robbery and served 7 years before being released in 2012.
It wasn't just I was locked out of 1 or 2 jobs. I was locked out of entire sectors. I can't work in finance. I can't work in insurance. I can't work in government. I can't work in education. So I'm forced to find these low-level jobs, and it was demoralizing. Even though I paid my debt, even though I've paid my dues.
Ex-prisoners have long struggled to get a foothold in the labor market after their time behind bars. According to the Brookings Institute, roughly 45% report no earnings in their first full calendar year after release. For those who do get a job, the median income is $10,000.
You finish up the application and you have some employers that come back to you, well, Mr. Brooks, unfortunately, we can't hire you due to the fact that you've been incarcerated or you've been, arrested for this and that, and that just, your heart, it just breaks your heart.
Not only that, but probation and parole regulations means the chance of rearrest and imprisonment after release is also high. A 2018 DOJ study found 44% of former prisoners were arrested within 1 year of release.
I understand why he ran. I understand why he fought. Because being a black man in America, on parole, with a criminal record, living under quarantine and a pandemic, and just seeing a brother murdered by the police, I would have run and fight too.
The police officer who shot and killed Rayshard Brooks, Garrett Rolfe, was fired and charged with felony murder. Brooks leaves behind a wife and 4 children.
I want to piggyback on, us being, taken away from our family. It's hurting us, but it's hurting our family the most.
Jamal Andrus, Newsy, Chicago.
All eyes are on the U.S. as we deal with 2 major crises, which makes this a good time for some countries to spread unflattering information about us to the rest of the world.
We take a step away from the noise and spin to really hear and tell the stories that need to be told. Newsy cuts through.
Misinformation seems to have spread concurrently with the coronavirus. Some lies originated stateside, while others have come from abroad. As Newsy's Tyler Atkinson explains, social media accounts in Iran have been pushing false messages and half-truths to make the U.S. look bad to an international audience.
For years, Iran has been ramping up its online influence operations. Now that social media presence is being used to spread messages about the U.S.'s handling of the COVID-19 pandemic and protests for racial justice. Some of it is false. Some of it is just unflattering to the U.S.
one of the key narratives that Iranian officials, Iranian accounts started to push was that U.S. sanctions were the reason why Iran was unable to handle the COVID-19 outbreak. There is some truth, and that's something that rights groups have said for a while, but the way the Iranians were presenting it has kind of gone into the disinformation realm quite a bit.
Tabatabai says one of Iran's motives in spreading these COVID-19 narratives is to push back against sanctions by appealing to European audiences. Twitter and Facebook are effectively banned in Iran, but not in Europe, where some countries still have power to offset US sanctions.
What seems to drive a lot of the activity is actually external issues, to essentially try to galvanize the international community against the United States and rally them around the Iranian flag to try to stop the maximum pressure campaign and U.S. sanctions.
Iran has also used American demonstrations on racial justice to shine light on how the U.S. treats its own minorities and protesters. Tabatabai said this narrative is being spread to show how the U.S. can be hypocritical when it comes to criticizing other countries over their domestic affairs.
What they've been doing is mostly highlighting what our own press and media have been reporting within a framework that is, of course, very critical of the United States in general, and that is kind of favorable to Iran.
Tabatabai says it's still too early to know what effect Iran's messaging might have on the US and its allies, especially because it's less sophisticated than Chinese or Russian operations. In some cases, Iran is even pushing Chinese messaging instead of its own.
The Chinese, of course, have been trying to present themselves as part of the cure for COVID-19. And Iran has very much been pushing this messaging as well, trying to say that China, not the United States, is the solution.
Tyler Adkisson, Newsy, Chicago.
If you're thinking about using the restroom right now, just hold it. It won't be that much longer. At Newsy, we believe opinions are a beautiful thing.
But they belong to you, not us.
You're entitled to your own opinions, not ours.
Watch Newsy. Be informed, not influenced.
Outdoor seating at reopened restaurants is becoming a more familiar sight. I see it almost every day, and I can't help but to think, we must not have the same work hours. But just how risky is it to be eating out right now? If you've seen the show before, you know we're teeing up Lindsay Thies for another installment of What's the Risk?
When it comes to getting sick with COVID-19, you might be thinking about this, and we have two. Alex asked,
what's the risk of getting COVID-19 if I want to eat out at a restaurant, inside or outside?
We asked the experts. Their take, contracting COVID-19 from eating out at a restaurant is medium risk.
It's not the food part, it's the exposure to other people that we're really concerned about. And therefore, takeout's probably your safest bet. It would be nice to be able to do outdoor, especially if they can do distancing and limit the number of people.
The outdoor would probably be preferable to indoor, but going back to that social distancing and making sure that you can maintain that 6 feet of separation is really the most important piece of it.
It would be lower in an outdoor setting. We know that airflow, temperature, sunlight really play a big role in virus transmission, and so eating outside is safer than eating inside. The other risks come with how close you are to the other people who are at the restaurant, so moving tables at least 6 feet apart decreases risk, and then obviously how close you come in contact with your server is the other place where there's potential for transmission of infection.
If you have a question about your risk, email us a video question to whatstherisk@newsy.com.
States across the country are having to reckon with questions about policing, especially since the widely seen detainment and killing of George Floyd. As this next piece shows, some states are looking at revamping use of force laws that have been around for decades.
No justice, no peace.
In nationwide protests against police brutality, demands for police reform have been clear.
We want action!
But of course, this isn't the first time states have felt this pressure. Following a series of high-profile deaths starting in 2014, Michael Brown in Missouri, Tamir Rice in Ohio, Freddie Gray in Maryland, to name a few, dozens of states passed new legislation on police reform, but most failed to address a key issue: police use of deadly force laws. They specifically outline when a death at the hands of an on-duty officer is legal. These laws vary state to state, so a homicide by police could be considered a crime in one state and justified in another. And since 2014, only 6 states have changed their use of deadly force laws. The least restrictive laws allow officers to use lethal force when there is no immediate threat of serious injury or death. Other states say police can kill civilians only if they believe they are dangerous to officers or others. The most restrictive laws say officers can kill only if it's necessary.
The laws that regulate police use of force are relatively permissive. Officers are expected to use force as part of their jobs. They are empowered and authorized to use force as part of their jobs. So the mere fact that an officer uses force or even kills someone is not by itself enough to establish a criminal violation. So prosecuting police officers is a tough row to hoe from the very beginning.
Most police departments aren't required to report when they use deadly force. But data that does exist shows just how rare it is for police to be convicted or even prosecuted for killing civilians. According to the research organization Mapping Police Violence, at least 7,437 people were killed by on-duty police officers between 2013 and 2019. During that time, 62 officers were charged. 14 were convicted of a crime.
So we need change. We need change in the laws, and the time for change is now.
Since the death of George Floyd, there's renewed momentum across the country to change use of deadly force laws, especially in Minnesota, where lawmakers are calling a special session to address reform.
We have laws, quite frankly, that are there that protects bad cops. You know, they can justify so easily why they done what they did and get off with it, and just get off. And so we really want to try to move legislation that gets to the root causes.
I have been talking to my colleagues about passing meaningful policy reform so that no law enforcement officer gets off with killing one of us again.
Just last week, state lawmakers in Colorado and New York passed legislation that would make more police actions criminal. But some in law enforcement caution that states may be moving too fast.
Many of the things in this bill we already do here at the sheriff's office. They're trying to do all this in a week and a half. And there'll be some consequences that over time will have to probably be revisited.
But historically, changing use of deadly force laws has been slow. In California, one of the oldest laws on the books, from 1872, was just changed last year. Today, 11 states haven't amended their laws in more than 40 years.
It is really crucial that we are updating our police accountability laws into a 21st century mindset of where we are and what we want into the future.
Carrie Cochran, Newsy.
That's a wrap on this week of In the Loop. For those celebrating, happy Juneteenth and happy Pride Month. We'll be back on Monday with all the hits. But don't go anywhere just yet. More top stories are headed your way right now.